So are there any specific individuals or people with certain diseases or diseases they'd want to prevent who might specifically benefit from an anti-inflammatory diet? The type of anti-inflammatory diet that you're describing.
Well, we know that chronic higher levels of sort of the basal inflammation is an important risk factor for development of diabetes and heart disease, if not one of the best predictors of your chances of developing those chronic diseases. So, if you have a high level of C-reactive protein, for example, is often looked at as sort of a good overall marker of somebody's systemic level of inflammation. If you have a higher level of CRP, it puts you at a higher risk of developing these diseases. So I think, first of all, those people who have higher levels of these constitutive markers of inflammation would be candidates for low carbohydrate diets. And I would just add on to, Steve talked about low carbohydrate diets being anti-inflammatory, and I would actually consider that a sort of additional facet to the term carbohydrate intolerance. There are people that, there's evidence that if you're insulin resistant, or if you actually do have an inflammatory response to carbohydrates, and it's probably mediated through the insulin response and the role that insulin plays on some of these inflammatory markers and production of these cytokines and so forth. So I think it's part of our definition of carbohydrate intolerance is also an inflammatory response to carbohydrates, as well as a propensity to convert the carbs into fat and so forth. So I think it's the same people that tend to convert carbs to fat that also tend to have an inflammatory response to carbohydrates, and so they are also the groups of people that are most well suited to benefiting from a low carbohydrate diet.